What happens to a patient after they pass away in the hospital? For those of you who don't know me, my name's Ashley and I am a nurse. I've been a nurse for 8 years, but I have spent the last 7 years working in the ICU, and I take care of the sickest of the sick patients, which unfortunately means a lot of times patients pass away. So this is going to be the behind the scenes of what the nursing staff and healthcare staff do with a patient after they pass away in the hospital. But just a little disclaimer, every hospital is going to be just slightly different depending on the resources they have as well as your policies. So this may be a little different depending on where you work. So the first two things that I do when a patient passes away, one is I call our donor network. I work in Arizona, so I call the donor network of Arizona, but depending on the state that you work in, you'll have a different donor network. But I have to call and report the patient's time of death within 1 hour after they pass away in order for the donor network of Arizona to have record of that patient passing away and see if they have any potential to be a tissue donor. I don't do anything else with that. I just report the time of death, and then the donor network of Arizona will take it from there to determine if the patient has any potential to donate any tissue. The second thing I do is determine if the patient is a medical examiner's case. Now, there's many things that can qualify you to be a medical examiner's case, but usually you have like a suspicious death, an unexpected death. We don't quite know what caused your death. But if it's a medical examiner's case, I will have to call the medical examiners to see if they accept that case. But most of the time, we aren't calling into the medical examiners because a lot of the deaths in the ICU are expected and anticipated. Just a little random tip here. Not all cases are accepted by an ME, and if a family is adamant that they want an autopsy or something to look into the patient's death, they can hire a private medical examiner to do an autopsy on a patient. Once the patient's family and loved ones have all left, nobody else is coming into the room to say goodbye to the patient, I will get them all cleaned up and prepped for the mortuary. Not every hospital will have a mortuary on site, but my hospital does because it's quite large. So I will get the patient's lines taken out, their Foley, if they have central line IVs, and I will get them all nicely cleaned up to put them into a body bag. From there, I fill out some paperwork with the patient's time of death information, as well as if I call the medical examiner, if I called the organ donor, it has to get signed by our house supervisor, and then the patient will get transported on a cart down to the mortuary. Once the patient's down in our mortuary, the families will choose which funeral home services they want to go through, and then our mortuary will coordinate with whatever funeral home the family chooses in order to get the patient's body over to that funeral home. I know this is kind of a lot of information and it's kind of a harsh topic, but it is the reality and something that I deal with literally multiple shifts a month. But if you have any more questions, let me know, and I hope this was helpful.